So my name's Mark Lawrence. I'm the Director of the Food Policy Unit at IPAN at Deakin University.
So my name is Jess Fanzo. I'm a professor at Johns Hopkins in Food and Agriculture Policy and Ethics. I'm on sabbatical this year to the FAO in Rome, which is very nice. My work is mainly at the intersection between nutrition, agriculture, and the environment.
My name's Sandro. I'm a medical doctor by training. I have a PhD in public health and epidemiology. I've worked in clinical setting as a doctor, in academia, previously at the World Health Organization, and now I'm CEO of a global foundation focused on food system transformation called EAT.
Hi, I'm Phillip Baker. I'm a postdoctoral research fellow at Deakin University. My work covers a number of topics relating to food systems and nutrition.
It's a really important moment in time. I think people are realizing that food is a critical element to global development, and it has a lot of contentious issues surrounding food and how it moves through our world and who gets what kind of food, and the equity issues around that. So I think it's an important time to be looking at nutrition policy. From my perspective, I think that when you're thinking about nutrition policy, we have to remember it's not owned by health, but it's also owned by agriculture, it's owned by environment, it's owned by education. So we're really in need of more of a multi-sectoral, multidisciplinary type policy when it comes time to thinking about food and nutrition.
So I'll be focusing on the role of cities and how cities can be a great way of driving important nutrition-focused and public health-focused policies forward. Cities are a great way to achieve public health outcomes through policy for a number of different reasons. First of all, 50% of the planet now lives in cities or in urban areas, and by mid-century that will be about 70% of the planet. So first of all, urban health is global health to a large degree. And whilst we can't ignore those living in rural areas who often are the basis of our food system, for example, we need to focus our resources also where we can have the greatest impact, and cities are one of those important platforms.
Well, there are lots of opportunities at the moment, not least because the evidence for acting is about as strong as it's ever been. So we've got a lot of national and international researchers who are coming out with really strong evidence about what needs to be done, why it needs to be done, who should be doing it, and so on. So I think that's a real opportunity there. Whether it gets acted on is going to be the challenge, of course.
One key question that I really look at in my research and what I'm going to be talking about today is how do we make food and nutrition policy happen? How do we make food and nutrition policy? How do we ensure it gets implemented? How do we make sure that we can use policy levers to improve the health of populations? And so part of that involves asking this question, why are some countries successful in tackling malnutrition, whereas other countries are not successful at all? And so to really understand that question, I'm going to bring into focus some countries that have been really successful. Countries like Brazil, who has really brought down rates of malnutrition in that country. Countries like Mexico, Mexico has recently had a sugar-sweetened beverage tax adopted. Lessons from other countries around the world as to how they got those food and nutrition policies up, why they were effective, and how we might learn from that here in Australia.
We still often face the same challenges. There are the discussions around, is it the role of government to intervene in the first place? And that's, a big discussion that continues and divides populations. I think hopefully most of us agree, the end point that we want to achieve, but very much often disagree on how we get there.
It's a time where we have to think about what can we do to improve the food system. Every bite we take of food has some sort of action or has some sort of implication on someone else somewhere in the world. So I think we need to start realizing that what we eat matters, and do we have the right to eat wrongly? we need to be thinking about these more ethical issues and how the decisions that we take about what we eat and how we get our food has implications around the world.
Food and nutrition are really complex problems. They cross a lot of different areas. We're talking about agriculture, we're talking about education, we're talking about health systems, we're talking about food regulation, we're talking about social protection and social welfare, and we're talking about urban planning and a whole range of other policy sectors that all link into nutrition and food in some way. Okay, and so the question is, how do we get everyone working together? How do we get everyone on the same page? How do we get what we call coherence across these different sectors? That is really, I think, the biggest challenge we face.
So I think we're very aware of the problems, and as I said, we've got this evidence base to act on those, but the challenges are quite strong. So there's politics. I mean, I'm very interested in not just the science of these issues, but what's the politics? We'd be really naive to think, so long as we get enough evidence and the science is strong, that policies are going to happen and everything's going to be solved. As much as we'd like that to happen, it doesn't work that way. So inevitably, politics shapes the evidence that we're collecting, how we use that evidence, how maybe that evidence is tweaked or not used.